et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shephard, Ministre de la Santé. Dr. Russell.
Thank you, Bruce. Merci. Bonjour à toutes et à tous. Good afternoon, everyone. Before I start, je voulais juste dire, je sais qu'il y a un groupe de Facebook à Zone 4 qui est vraiment positif. Puis j'ai une petite surprise cet après-midi. Je vais leur envoyer un petit message, mais je sais que c'est quelque chose qu'ils ont organisé eux-mêmes dans la Zone 4, puis c'est quelque chose qu'ils partagent des choses très positives. Alors, je voulais juste dire un mot là-dessus. Depuis 2 semaines, des restrictions plus rigoureuses ont été imposées dans 2 des zones de santé publique pour limiter la propagation du virus responsable pour la COVID-19. La zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick, est à la phase d'alerte rouge de notre plan de rétablissement depuis le 19 janvier. La zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin, est passée à la phase d'alerte rouge le 17 janvier et à la phase de confinement le 23 janvier. Bien que nous réalisons des progrès et que le nombre de cas semble diminuer, les restrictions présentement en place dans les 2 zones demeureront en vigueur au moins jusqu'au début de la semaine prochaine. Et nous réévaluons continuellement la situation dans ces zones et nous sommes fermement déterminés à permettre à ces collectivités de sortir de ces phases restrictives. Pour ce faire, d'autres progrès doivent cependant être réalisés. For the past 2 weeks, 2 of our public health zones have been under enhanced measures of public health restrictions to limit the spread of COVID-19. In Zone 1, which is the Moncton and southeastern New Brunswick region, this has been in the red alert level of our recovery plan since January 19th. In Zone 4, which is the Edmundston, Grand Falls, Saint-Quentin area, they moved to the red alert level on January 17th and has been under lockdown since January 23rd. While we are seeing progress in the numbers, and they appear to be trending in the right direction, restrictions now in place in these 2 zones will continue until at least early next week. We are continually reevaluating conditions in these zones, and we are firmly fixed on the objective of getting these communities out of their current restrictions. And I appreciate the efforts that everyone in Zone 1 and Zone 4 are making to limit the spread of COVID-19. And I can't stress this enough. I know many people are working very hard under very stressful conditions. So I do appreciate that, and I thank you for your efforts. The virus is still present, and it is in charge, and we need to do all we can to fight it. In the days ahead, we will be watching for signs that the outbreaks in these areas can be contained with fewer restrictions on public movement, and I hope to be in front of you on Monday with that good news. Aujourd'hui, j'annonce qu'il y a 16 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. Il y a 5 nouveaux cas dans la zone 1, soit la région de Moncton et du sud-est du Nouveau-Brunswick. Dans la zone 3, soit la région de Fredericton et de la vallée de la rivière Saint-Jean, il y a 1 nouveau cas. Il y a 9 nouveaux cas dans la zone 4, soit la région d'Edmundston, de Grand-Sault et de Saint-Quentin. Il y a 1 nouveau cas dans la zone 6, soit la région de Bathurst et de la péninsule acadienne. Il y a maintenant 256 cas actifs de COVID-19 dans la province. De ce nombre, 5 personnes sont hospitalisées après avoir contracté la COVID-19, dont 2 aux soins intensifs. Je vous demande une fois de plus de garder ces concitoyens du Nouveau-Brunswick dans vos pensées et vos prières. Today, there are 16 new confirmed cases of COVID-19 in New Brunswick. In Zone 1, which is the Moncton and southeastern New Brunswick area, there are 5 new cases. Zone 3, which is the Fredericton and St. John River Valley, there is 1 new case. In Zone 4, which is the Edmundston, Grand Falls, Saint-Quentin region, there are 9 new cases. In Zone 6, which is Bathurst and the Acadian Peninsula, there is 1 new case. We now have 256 active cases of COVID-19 in New Brunswick. There are 5 individuals now in hospital, of whom 2 require intensive care. And again, I ask that you keep these fellow New Brunswickers in your thoughts and prayers. Public health remains concerned about outbreaks at several long-term care facilities around the province. Mass testing of residents and staff is occurring today at Manoir Bellevue Adult Residential Facility in Edmundston. And one of the regional medical officers of health had asked me to pass along the good news that there were 10 of those residents who were released from their 14-day self-isolation today. So that was good news. Tests were done yesterday at the Villa Desjardins in Edmundston, and we are awaiting the results for these latest tests. This complex includes an adult residential facility as well as independent living apartments. We have also done testing in the Pavillon Royer long-term care facility, and all results to date have come back negative. I am pleased to report that the Parkland St. John facility, we've had no further positive cases from the last 4 rounds of mass testing, and another round of tests is set for Monday. Le dépistage de masse des résidents et des membres du personnel du Manoir Bellevue, un établissement résidentiel pour adultes à Edmundston, sera effectué aujourd'hui. Des tests de dépistage ont été effectués hier à la Villa Desjardins à Edmundston et nous attendons les résultats de ces plus récents tests. Ce complexe comprend un établissement résidentiel pour adultes ainsi qu'une section d'appartements pour personnes qui vivent de façon autonome. Nous avons également effectué des tests de dépistage au Pavillon Royer, un établissement de soins de longue durée, et tous les résultats se sont avérés négatifs jusqu'à présent. Je suis heureuse d'annoncer qu'aucun résultat positif n'a été signalé dans le cadre des 4 dernières rondes de dépistage de masse au complexe Parkland à St. John. Une autre ronde de tests est prévue lundi. Nous devons demeurer en état d'alerte car le virus change. We all have to remain on alert because the virus is changing. And I know people have been reading in the news about the UK variant and other variants that are out there, the African variant, the Brazil variant. We know now that the UK variant of COVID-19 is in our province. It transmits more easily and spreads more quickly because the viral load is higher. Therefore, there is more shedding of the virus and it binds to our cells more easily. Even with the original version, we have seen many cases where casual contact has led to an explosion of infections through many chains. One case related to travel can go on to transmit to up to 90 or more people through a chain that goes from a household to a workplace to a gathering, etc. With the new strains, these are up to 30 to 70% more contagious. We will see even more infections and faster spread of the virus, and that's what's so concerning right now. Instead of infecting 90 or more people, one case could transmit to hundreds of people through that same type of chain. And when you do the math, it would cause more hospitalizations and more deaths because we know that about 5% require ICU admission. We all need to keep doing the right things to slow the spread of COVID-19, especially in the face of these new variants. One person can unknowingly infect others, but everyone along the chains of infection are examples of how we all have a role to play in the continued spread. We need people to come forward and be willing to be tested at the first sign of symptoms. Please do not hesitate because of fear of one might say, and don't minimize your symptoms. Transmission happens even faster with the new variant, as we mentioned before, and it can lead to more infections, which lead to more hospitalizations, which leads to more deaths. Catching COVID-19 is not your fault. And I'm just going to say it again, it is nobody's fault. COVID-19 exists. It is a virus that has caused this global pandemic that continues to affect millions and millions of people right now. No one should be ashamed for catching it. When considering symptoms, it is very important to keep in mind there has only been one case of influenza detected in New Brunswick so far this year. Normally we see between 300 and 600 hospitalizations per flu season, and this year we have 0 hospitalizations from the flu. So if you have symptoms that you would normally associate with a cold or a flu, please get tested. It is more likely that you have COVID-19. It is very difficult It is really difficult for everyone because we can't see it. But we've done such a great job as a province. We've done so extraordinarily well. I get the information from across Canada every week on how many cases, how many active cases, how many hospitalizations, how many deaths, etc. And really and truly, New Brunswick has done so well. Nous devons tous éviter les grands rassemblements où le nombre élevé de contacts étroits peut accélérer la propagation du virus. La période des fêtes nous a appris une dure leçon sur la rapidité avec laquelle le virus peut se répandre dans le cadre de ces rassemblements informels, surtout si vous avez des symptômes et vous ne vous faites pas tester. Chaque année, pour la partie de championnat de football américain, le Super Bowl, il y a habituellement des fêtes organisées à la maison et dans les bars. Cette année, je demande à tous d'éviter de se rassembler en grand nombre pour regarder la partie qui a lieu en fin de semaine. Limitez vos rassemblements aux membres de votre bulle immédiate ou votre groupe de les mêmes 10 si vous choisissez d'inviter des gens chez vous pour regarder la partie. In the days ahead, we all need to avoid gatherings with close contact where the virus can quickly spread. We learned a hard lesson over the holidays about how quickly the virus can be spread through gatherings, especially if people ignore very mild symptoms and don't get tested. And I was speaking with one of the regional medical officers, well, I was speaking with both regional medical officers of health today, along with the deputy chief medical officer of health, and they were really emphasizing how mild the symptoms can be. And he was saying, you know, it's not the Walking Dead. You know, we're seeing very mild symptoms. So you don't expect to be seeing people with very severe symptoms. They can become more severe for sure. But when people have very mild symptoms and don't get tested, that's when the outbreaks can happen and they transmit very quickly. So this weekend we would traditionally see house parties and celebrations in bars and restaurants around the Super Bowl football game. But this year, I am asking everyone to avoid gatherings to watch the Super Bowl. Limit your gatherings to your immediate household and keep it to just a few from your steady 10 if you're having people over to watch the game. If everyone keeps their gatherings small, it will give us a better chance to trace contacts should infections happen. You can still cheer for your favorite team, but keep in mind that the pandemic is still with us. No one wants their Super Bowl party to turn into a super spreader event. With the variants now increasing the risks, we need to be more vigilant. Our journey through this global pandemic is not over, and we cannot allow the new variants to take hold in this province. The longer we can prevent that from happening, the better, and we can get our vaccines rolled out. As tired as we all are, it is vital that everyone continues to do what is necessary to slow the spread of the virus. We need to support one another, and we need to take care of ourselves. We can weather the storm that this winter has brought. Better days are ahead if we continue to have team spirit and put aside our individual needs for the greater good of New Brunswickers. Nous pouvons résister à la tempête que nous devons affronter cet hiver. De meilleurs jours s'en viennent si nous continuons à prendre les bonnes mesures maintenant. Merci beaucoup. Thank you.
Merci, Dr. Russell. Merci, Bruce. Good afternoon. Bonjour. Earlier this week, we learned that the UK variant of COVID-19 has been detected in New Brunswick. This wasn't unexpected, but it is troubling news. The presence of a COVID-19 variant here in our province is serious concern. Now more than ever, we need to follow the rules that are in place to protect us. We need to remember that the virus cannot travel on its own. It depends on people to spread it. That is why it is so crucial that we avoid any unnecessary travel. It is why those who do travel must follow isolation guidelines upon their return to New Brunswick. I understand that we are asking a lot when we say that travelers, including rotational workers, must self-isolate for 14 days away from their loved ones. I'm not going to pretend this is easy. It's painful, and it may not seem fair. But COVID-19 does not have a sense of fairness. I want to be clear. The problem is not rotational workers themselves. The problem is that all travelers are susceptible to the virus. No one intends to contact COVID-19. Nobody wants to make other people sick. But it can happen to anyone at any time. The only way we can protect New Brunswickers, especially our most vulnerable residents, is by imposing these tough guidelines. Currently, we are in a vulnerable state. Zone 1, the Moncton region, is in the red alert level, and Zone 4, the Edmundston region, remains in lockdown. As Dr. Russell mentioned, right now, the numbers are looking positive in both regions. On Monday, we will reassess the situation. If the number of active cases continue to decline over the next few days, we will consider changing the alert level in Zone 1 and Zone 4 at that time with public health input. While I know we would all like to see the province go back to yellow, that is not an option at this time. We need to get some restrictions in place while we get outbreaks under control, and we need time to ensure COVID-19 variants are not spreading. For now, our goal is to move the entire province to the orange alert level as soon as we can. That way, more businesses will be able to open and we can enjoy time with our steady 10 while still taking precautions to slow the spread. I'm very grateful to the volunteers who have stepped up in Zone 4 in recent weeks. Healthcare workers from that region and across the province are providing their services in the long-term care and special care homes that have been impacted by the outbreaks. Civil servants have volunteered to be redeployed to Edmundston to provide important non-specialized services, such as meal delivery for residents. I'm also thankful to the culinary arts students from CISAMB who have been providing meals to residents at Manoir Bellevue since earlier this week. This is how we get through these latest outbreaks, by working together and by taking care of one another. Vaccines are coming, but we still need to be patient. Right now, we are continuing to focus on vaccinating our most vulnerable residents with the doses we have. This includes residents and staff in long-term care facilities, as well as healthcare workers. Unfortunately, we still do not have enough doses to vaccinate all vulnerable New Brunswickers. We are currently assessing our rollout plan and exploring how we can best manage delays in vaccine delivery. We are still committed to ensuring everyone in our first priority group is vaccinated by early spring, but this depends on the federal government's ability to deliver the anticipated number of doses. We will continue to keep New Brunswickers informed once we have the information. I know we are all eager to see vaccines become more widely available. We are all tired of catering to the demands of COVID-19. But despite the fatigue we are feeling, we must stay the course and remain vigilant. If we can do this, I know that we can get our province back to a state where we will all be subjected to fewer restrictions. We will be able to move around more freely. And we can even get back to a place where we can consider reopening the Atlantic bubble. New Brunswick is the first line of defense in keeping the virus out of Atlantic Canada. And that is why we must continue to keep a tight hold on our borders to protect our province and the entire region. Right now, we are heading in the right direction. We all just need to keep up the great work. Continue to wear a mask in public and maintain a safe physical distance from others. If you have mild symptoms, even if you think it's just a cold, please contact 811 and arrange to get tested. As Dr. Russell mentioned, if you think you have the flu, it's more likely this year that it's actually COVID-19, and you need to get tested to be sure. If we all continue to do my part, I'm confident the entire province will be back in orange very soon. And Dr. Russell talked about this Sunday being Super Bowl Sunday. Let's not fumble the ball. Let's stay with it. Let's be diligent. Let's be disciplined. Keep to your steady 10 or less. Keep your families at home. Enjoy the game there. Thank you. Merci.
Merci beaucoup. Thank you, Dr. Russell, Mr. Shephard. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question. Voulez-vous garder vos questions très courtes et concises, s'il vous plaît? Voulez-vous assurer de désactiver le son de vos micros? We'll now proceed with questions from members of the media. Each reporter will have one question. We ask that you make it a short and concise question. There's 22 of you on the line today. You have the right to pose your question in the official language of your choice. Please ensure your microphone is placed on mute. Gilles Duval, TVA.
Oui, bonjour. Est-ce qu'on pourrait savoir de la part de Mme Russell si on a identifié la source donc de contamination, que ce soit au manoir Bellevue ou encore à la Villa des Jardins?
Bonjour. L'information sur les cas index, j'ai pas cette information et pour protéger la confidentialité, c'est vraiment important qu'on est vraiment consciencieux de cette information. On sait que tous les cas qui sont venus au Nouveau-Brunswick sont pas mal tous liés au voyage et après ça, un contact étroit de quelqu'un qui a voyagé et après ça, un contact étroit d'un contact étroit. Alors, n'importe où dans la chaîne de cette transmission, ça peut arriver que quelqu'un ait le cas index, mais on veut vraiment protéger la confidentialité. Les gens qui soit visitent ou soit des staffs ou soit des résidents comme tels qui peuvent aller et venir, on veut vraiment protéger cette information.
Merci, M. Duval. Kevin Bessick, Canadian Press.
Yeah, good afternoon. I'm not sure who would like to answer this question, but agriculture groups in the province say that temporary foreign workers play a key role in the security of food supply, and they'd like to have them included in the next wave of COVID-19 vaccinations after healthcare workers and long-term care residents. Can you comment on where long-term or temporary foreign workers would be right now in the order for vaccinations?
I'm going to take that question. Dr. Russell can follow up if I leave something out. But the fact is that the very best way for us to protect against the arrival of a COVID-19 case is with our self-isolation for 14 days. It proved very effective in the past year. As we had temporary foreign workers come to the province, they isolated, usually in a same hotel. And we had our employers take diligently that effort. Any COVID cases were found while the isolation was happening and there was no spread. So at this time, I'm not going to assume that we have temporary foreign workers on any of the priority lists within the first, certainly 2 queues. And with the availability of the vaccine, I don't see us altering that right now.
Thank you, Mr. Bissett. Silas Brown, Global TV.
Hi there. We've seen some changing guidance around masking in other jurisdictions, talking about quality of mask, how often to change them, and potentially double masking. Is New Brunswick changing guidance around masking at all? Is double masking being recommended? Can you elaborate on that?
Hi, Silas. First of all, I want to thank New Brunswickers for wearing their masks. I think we went from about a 50% compliance rate to about a 99% compliance rate. So New Brunswickers are doing very well with masks right now. Are we going to up our game? We have recommendations from Public Health Agency of Canada right now around a 3-layer mask, so 2 layers of cotton and then a filter layer. But certainly the fact that people are wearing their masks is more important now worrying about the variants being here. So any measures that we have in place right now to protect us against COVID-19 are even more important now that we have the variant. So anything that we can do to increase all the measures that we have in place, including adding a third layer to our masks, is a really a positive thing. So Public Health Agency of Canada is recommending 2 layers of tightly woven fabric such as cotton, and then a third middle layer of a filter-type fabric, such as a non-woven polypropylene fabric, which is washable or disposable. So these are the ones that you take that filter out and you can wash it. So, and I know that if it gets soiled or if it's wet, then you really have to replace it. So it's better to have a good collection of them.
Thank you. Marie Sutherland, CBC.
Hi, thank you. My question's for Dr. Russell. You mentioned earlier this week that the individual is related to the variant cases or self-isolating, and this seems to be more crucial than ever with the variant speedier transmission. So can you tell us, or do you know, if each of them self-isolates immediately upon arrival home from travel, and how is that being checked on?
My understanding is they did self-isolate immediately. So, and the same protocols that have been used in terms of checking in on people and the registration process, that hasn't changed at this point in time. But we certainly, one thing we did do is we did reactivate their cases in terms of continuing, once Public Health found out that they had the variant, when they got that information back from the National Microbiology Laboratory, they then went back to make sure that there was a very thorough look at their situation and if there were any risks that needed to be mitigated as a result of the fact that they now had this information about the new variant and being positive for the new variant.
Thank you, Doctor. Before we proceed, can everybody please mute your microphones? Emma McPhee, Telegraph Journal.
Yes, my question is for Dr. Russell. I'm asking this question on behalf of a 91-year-old grandmother from Milledgeville. Her name is Vera Wood, and she wants to send a box of homemade cookies to her grandson in Ontario, but wants to make sure it's safe to do so under COVID-19 guidelines. So on behalf of Vera and loving grandmothers everywhere, is it safe to send homemade cookies in the mail?
Yes, it is.
Thank you, Doctor. Thank you, Ms. McPhee. Maude Montembeau, Radio-Canada.
Bonjour, ma question est pour Dr. Russell. D'abord, enchantée de faire votre connaissance par le biais de cet appel téléphonique. Est-ce que vous pourriez me dire, bon, il n'y aura pas de changement dans les zones 1 et 4 pour la prochaine semaine, mais à quoi on peut s'attendre pour la mi-février? Il y a d'autres provinces aussi qui ont déjà mis leur plan pour la semaine de relâche. Alors, pouvez-vous nous donner une idée à plus moyen terme à quoi s'attendre et les critères qui vont guider vos décisions?
Les critères pour relâcher les phases?
Exact.
Ça, c'est déjà sur notre site web, tous les déclencheurs. Et à ce moment-ci, on attend à voir que la situation est stable et s'améliore dans les zones 1 et zone 4. Et pour le reste de la province, on reste dans la phase orange à cause de les risques des variants. On veut que personne voyage si c'est pas nécessaire et spécifiquement on décourage les étudiants de voyager durant le congé de mars.
Merci beaucoup, Callum Smith. Sorry, Maude, we got to proceed. Callum Smith, Global.
Hi there. I'm wondering with the orange phase restrictions and changes that are being made, would there be any consideration to allow sports games to continue? I know in obviously very different story, Nova Scotia, but no fans are permitted, but is that something New Brunswick would consider?
So at this time, teams are allowed to do their own practices and scrimmages, but we are not allowing teams competitions or tournaments of any kind.
Thank you, Mr. Smith. Matthew Boiscomo, L'Acadie Nouvelle.
Dr. Russell, je comprends bien qu'on ne reviendra pas en phase jaune en raison des variants. J'aimerais savoir qu'est-ce qui vous manque au Nouveau-Brunswick, quel genre de préparation vous êtes en train de faire pour pouvoir retourner en jaune malgré la présence des variants? Est-ce que c'est une possibilité? Et puis, qu'est-ce qu'on fait pour se préparer à ça?
À ce moment-ci, on est vraiment hâte que toute la province soit en orange, tout ensemble en même temps. Ça, c'est notre but à ce moment-ci. Alors, on attend que les choses améliorent dans la zone 1 puis les zones 4, puis éventuellement, on sera tous dans la phase orange. Quand on est tous dans la phase orange, que je crois qu'on va continuer à avoir plus d'informations sur les variants. On va voir les effets dans d'autres provinces, ce qu'on voit déjà dans la province de l'Ontario. On sait que ça prend environ 3 mois avant que le variant qu'on a maintenant est complètement remplacé par le variant du Royaume-Uni. Alors, on veut vraiment éviter que ça arrive ici. On veut vraiment mettre des ressources et des efforts pour prévenir, pour préventer que ça arrive ici au Nouveau-Brunswick. Alors, parce que chaque éclosion qui va arriver avec le variant, ça va être de plus en plus difficile de le contenir. Et on veut vraiment qu'on soit confortable avec les doses qu'on peut vacciner les gens avec. Alors, le plus longtemps qu'on peut éviter les variants, que les variants soient impliqués dans des éclosions, le plus longtemps on a pour dérouler notre programme d'immunisation.
Vicky Hogarth, CHCO.
Thanks, Bruce. Dr. Russell, on the COVID-19 dashboard under case origin, it says that New Brunswick has had 18 instances of community transmission since the pandemic began. Can you give us, without going into detail, an idea of what type of scenarios and circumstances community spread took place at, and if community spread happened in spite of people following protective measures, or if it was more likely because they didn't?
So there's a difference between community spread and community transmission. Community spread we have seen over and over again in the sense that a traveler can then transmit to their household member who then transmits to a gathering or a workplace, etc. So all of the cases that we say have been travel related and then cause transmission throughout different chains, that's the majority of all the cases in New Brunswick since the beginning of the pandemic. The ones that we call community transmission are the ones that we couldn't link back to an original traveler. And so we haven't really had very many cases like that, which is great, because once community transmission takes hold, it's very, very hard to stamp it out. When you see unlinked chains, people popping up out of nowhere who have no links to any other places. So we see that in other provinces, and that's why they can't get their numbers down. So we have been very fortunate up until now to be able to avoid that situation, in so much that every single time we've had outbreaks, we're able to contain the outbreaks after a week, 2 weeks, 3 weeks, 4 weeks. So right now we're still battling the outbreaks in Zone 1 and Zone 4. We're having success. We're moving in the right direction. So we were really looking forward to stamping out those outbreaks.
Laura Lyle, CTV.
Hi, thank you, Bruce. This question would be for Dr. Russell. Dr. Russell, how do you determine whether a sample should be sent out for variant testing, and how many are now outstanding or waiting to be tested?
So much of all of the samples go to the National Microbiology Laboratory in Winnipeg. What's different with the variant is that if you want it flagged to have a turnaround time that's quicker, and the shortest turnaround time is a week, then we can do that. So we have sent out, I think it was, at one point we had sent out 18, and then most of them came back negative with the exception of 3. So I think we had 178. 178 went out to National Microbiology Lab since December 23rd to get sequenced for the variant, and 139 came back negative, 3 came back positive, and we have 36 that are pending. And the way that they're sending them out, we do have criteria to identify people that we think are higher risk. So travel to areas that are high risk. And that's going to continue to evolve, because now that it's found in more and more places, then we understand that it's going become increasingly problematic, and over the course of 3 months, we will see the variant, the UK variant anyway, replace the current variant, the current version of COVID-19. So we expect that to happen. But we also do what's called sentinel testing. So they pick randomly from each of the 7 zones each week. And that's how the Miramichi sample came back positive. It was one of the random sentinel test results that was sent.
Thank you. Harry Forrestal, CBC.
Thank you, Bruce, and thank you, Dr. Russell. The question for you, regarding your caution to New Brunswickers on this Super Bowl weekend. I don't want to be the skunk at the garden party, but in my house there's a daily debate over what prohibitions really mean and how they should be interpreted. I have 2 teenagers that I live with. The Minister of Health today says we need to follow the rules more than ever. We're all in a vulnerable state. You say, if you're going to have a Super Bowl party, keep it small and limit it to your steady 10. What people walking away from that are hearing is, Dr. Russell says it's okay to have a Super Bowl party. There's mixed messaging, or there is the appearance of mixed messaging. How worried are you about that, and what more can you do to be clear on the restrictions that a lot of the New Brunswickers are telling media they want to see in place?
I don't think you're a skunk, Harry. You know, I wouldn't want it to be mixed messaging. Obviously, ideally, I would like there to be no Super Bowl parties. I would love there to be, you know, no Super Bowl this weekend, in the sense that I wouldn't want there to be a temptation for higher risk gatherings, period. We don't live in a perfect world, so it's important to be realistic about what people want to do and what people expect to be able to do safely and how to help them do that. So I do not want people to have Super Bowl parties whatsoever. But if people are going to have a gathering in their home, then I want it to be as small as possible. And the only people that should be there would be the people that are part of your steady 10. But that is not a license to have all of the 10 people on your list at your house this weekend. So preferably no Super Bowl party, just your family. And if you are going to have people over, have it be the smallest number of people possible.
I'm just going to echo Dr. Russell's words, because, you know, we are not in a prohibition, so to speak. And the fact of the matter is that we know that we're human. We don't want gatherings. We would wish you not to gather at all. But there are sometimes very valid reasons to get together, to grieve, to get together, to, you know, to have a special dinner maybe for a family that normally would have hundreds of people attend, but will maintain their family household bubble plus 10. So it is with the greatest of reverence that we ask all New Brunswickers to gather as little as possible. Thank you.
Maria Varsano, Radio Canada. Sorry.
I just want to make one last point about gatherings. We need people to get tested if they have mild symptoms. We need people to not gather at all if you have symptoms. So what has gotten us into trouble is people not taking their symptoms seriously enough, thinking that it was a cold, brushing it off, and not going to get tested for whatever reason. We have the capacity to test. Please call 811. Do not gather anywhere. Do not leave your home. Isolate if you have a symptom. Get tested for COVID-19. That is the smartest thing to do at this point in time, in advance of you know, going to any kind of a gathering. So that is what has gotten us in trouble before, is people who have symptoms, even if they're very mild, not getting tested. So please get tested even if you have mild symptoms.
Thank you. Maria Varsano, Radio Canada.
Oui, bonjour. Ma question est aussi pour la docteure Russell. Donc, en phase rouge, quand une personne passe un test de dépistage en étant asymptomatique, par exemple, lorsqu'il y a un dépistage massif dans une école, est-ce qu'elle doit s'isoler jusqu'à la réception de son résultat de test?
Alors, quand que les employés d'une école se font tester dans cette situation, il faut qu'ils vont à l'école pour recevoir le test comme tel, puis après ça, ils vont isoler jusqu'à temps qu'ils vont recevoir leurs résultats.
Nathan DeLong, Miramichi leader.
Good afternoon. My question, I think, is for Dr. Russell. Yeah, Daniel, you've mentioned you're obviously still committed to the vaccine rollout, of course, and I know it's expected to continue, although there have been supply issues. And you've also alluded to immunize vulnerable populations before you can move health zones to yellow and make vaccines more widely available. I'm wondering what the Miramichi Hospital's continued role in the immunization efforts will look like, and if you can give us some information on what the province's timeline is for increasing vaccine availability.
Our level of vaccine supply will allow us to immunize the long-term care facility residents and the healthcare workers who work at the long-term care facility residences by the end of March. And so that is the timeline at this point in time. I can't speak to the Miramichi Hospital and their role at this point in time, but again, the goal of the vaccine rollout is really about protecting individuals from serious disease and death. Obviously, if the most at-risk populations are vaccinated, then we would not expect to see as many hospitalizations and deaths as a result of outbreaks in those types of facilities.
Thank you, Dr. Jean-François Boisvert, l'Acadie Nouvelle.
Oui, bonjour. La question est pour Dr. Russell ou le ministre. C'est concernant le dépistage hebdomadaire qui est exigé à la frontière ou qui devra être exigé bientôt. On m'a transmis une note de la sécurité publique du Québec qui date d'aujourd'hui et qui avise à sa population que le Nouveau-Brunswick n'a pas encore la capacité de faire appliquer la directive et donc il n'est pas nécessaire pour les citoyens du Québec qui font la navette d'une province à l'autre de subir un test pour le moment. Est-ce que vous pouvez confirmer et élaborer un peu sur les raisons pour lesquelles le Nouveau-Brunswick n'est pas prêt et quand on doit s'attendre à la mise en place de cette directive exactement?
Merci. So we are working on a couple of different plans in order to make testing more convenient. New Brunswickers can be tested, but sometimes in some of the border communities, we don't have the testing easily accessible to them. So we're working on that, and we should in the very, very next little while be implementing a plan that would make those testings not only more convenient geographically, but also time-wise.
Let's see. Allison Sampson, CTV.
Good afternoon. I'm wondering, since Nova Scotia is offering rotational workers the vaccine in their second phase of their immunization plan, will New Brunswick follow suit and offer rotational workers the vaccine once the vulnerable are immunized?
I'm going to take that, and certainly the vaccine task force is going to have to really address that in whole. But the fact is that right now we don't even know if we have enough supply to get our priority groups in Q1 done by our deadline date of the end of March, and we continue to hope that we will receive those vaccines. And then the Q2 priorities, I do not see that group in this in that priority list, but again, it is an evolving situation as the vaccines become available.
Mia Urquhart, CBC.
Thank you. My question is either for Dr. Russell or Minister Shephard. Nova Scotia just announced that it will go by 5-year descending increments, beginning with those over 80 until every Nova Scotian is vaccinated. That approach was also recommended by the National Advisory Committee on Immunization. Will New Brunswick take this approach, and when will residents have a better idea of when they'll be vaccinated?
So we're going to have a whole lot more to say about the rollout of those vaccines coming out in the next couple of weeks. We're actually working on a plan for next week to inform the public as to why the variant is as big a concern as it is, and then vaccine rollouts pending that. But as you know, I believe we didn't receive any vaccine last week, and the vaccines that are coming are already slated, I believe, for second doses. So it is very difficult to answer questions about the vaccine rollout when the supply is so much in question. And so we're being guarded about how we unroll this information, but as soon as we can, we will be giving you the most current and accurate and as far into the future as we possibly can, so that the anticipation is there, for everyone in those groups that it will belong to. But as far as the criteria, we're still working on that as a finalized plan.
Tom Bateman, Brunswick News.
Oh, hi there. I also have a vaccine question. Manitoba Premier Brian Pallister said today that the idea of achieving herd immunity by September or in September is looking less and less realistic. He said he spoke to two premiers recently who now anticipate herd immunity in their provinces wouldn't be achieved until 2022 at the earliest, and the lack of availability in the interim will mean lives will be lost. I wonder if Minister Shephard shares that fairly grim outlook and whether New Brunswick is facing the same circumstance. Thank you.
I'm going to share a little tidbit that you'll get more information on in the next week or so, but we don't even know yet what herd immunity means and to what level we need the vaccine distributed in order to achieve it. So I'm going to be a little guarded with that information to say that we're still compiling information that we bring to the public to be completely transparent, and as that unfolds, that's when you'll be given those updates.
Thank you. Marie-Ève Brassard, Radio-Canada.
Bonjour, ma question est pour la docteure Russell. En fait, j'ai une question pour vous concernant les zones 1 et 4. Donc, vous avez mentionné que les chiffres étaient positifs, mais qu'on se repenchera sur la situation lundi. Ma question est la suivante. Quels chiffres, alors, dans la zone 1 et 4 sont négatifs en ce moment et qu'est-ce qui pourrait en changer en environ 2 jours pour vous faire prendre une décision différente?
Une chose qu'on... Oh, did you...
No. The same 4 days.
Oh. Alors, on a des réunions pour discuter, avoir des discussions sur tous les déclencheurs et les risques qui sont dans les zones présentement chaque couple de jours. Alors, la dernière fois qu'on a eu notre réunion, on a pris toute l'information, on a tout gardé de toutes les différentes façons avec la capacité des hôpitaux, si on peut faire notre traçage de contact étroit, le dépistage et aussi l'effet qu'il y a encore des situations comme des éclosions dans des foyers de soins. Alors, on aimerait que ça soit stable et on aimerait qu'on commence à voir les chiffres diminuer. Et la prochaine fois qu'on va avoir la réunion pour discuter, c'est lundi.
Merci beaucoup. John Woodside, All New Brunswick. Savannah Odd, Telegraph Journal.
Hi, my question is for Dr. Russell. You've said on several occasions it's important to learn as we go in the pandemic. So I'd like to know if you believe the restrictions in Zone 4 are working based on 2 weeks nearly of lockdown there. And has your team observed or learned anything new that you might consider next time a zone moves into lockdown?
We are definitely seeing benefits of the lockdown. We have seen benefits of the red phase in Zone 4 as well. We'd really like to see less than 3 cases a day, 3 or less cases a day, 3 or fewer cases a day in Zone 4 for sure. So we're going to, again, keep monitoring that situation, but I think, again, you can see the numbers, even in number of active cases that have gone down, because obviously right now what we're seeing in terms of some of the positive cases, which does reassure us also, is that they're close contacts of people who were self-isolating already, and their day 10 test came back positive, but they're not transmitting because they were already self-isolating. So we are seeing fewer cases in the community. So most of the cases in Zone 4 right now now are in the nursing home settings. And again, those are closed settings. So again, we're being reassured by the fact that those closed settings are not transmitting into the community.
Thank you, Doctor. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, you showed modeling the other day for January if the variants had been in play. What are your projections? What do your projections for February show now that the variant is in play?
Well, again, when we know that the case is not transmitted to anybody else, then that's great. Then we know that it's not circulating in the population. So, but I think it will be just a matter of time before we see cases that arrive that either don't self-isolate properly and transmit as a result of that. And then because we do have still people who cross the border for work and get tested that way, and truck drivers as well, that we could see variants come into the province that way. But as long as each and every time somebody tests positive for the variant, they've been self-isolating, we will be happy about that. But we just know that most times with the variant, people transmit before they even know they're positive. So when we talk about all the public health measures that are in place right now and how we've tightened them up as much as we can, now more than ever, we need 100% of the population to follow all the public health guidance right now, because it only takes one case, as you know, to transmit to, through a chain of transmissions to cause large numbers of people to become COVID positive. And with the variant, that just is an exponential number that's quite onerous and would interfere with our ability to roll out our vaccines.
I'm sorry, but what are the numbers themselves? What do your projections show?
So we don't have those numbers for you today, but what I can tell you is this, is that we are preparing to have a very public conversation with our population to help them understand how serious this variant is, and that will be coming along early next week.
Thank you. Isabelle Arsenault, Radio-Canada.
Oui, bonjour. Ma question s'adresse à la Dr. Russell. Alors, la santé publique demande à tout le monde qui passe un test en zone rouge de s'isoler en attendant leurs résultats. Alors, pourquoi on dit aux enseignants qu'ils peuvent quand même aller travailler à l'école quand ils attendent un résultat? Les enseignants semblent recevoir des directives qui sont contradictoires à la santé publique, en fait.
Alors, il y a une erreur dans la communication avec les employés dans cette situation. Alors, on va le corriger. Pour que les gens comprennent exactement quelles sont les directions, quelles sont les directives. Et on va vous parvenir les détails.
D'accord, merci.
That concludes today's update. Merci beaucoup. Voilà la fin de notre mise à jour.